So Ehlers-Danlos patients have loose connective tissue, and there's a lot of collagen in nerves, and I think their nerves are soft and the muscles are tight. And there's a universal problem for Ehlers-Danlos patients where the median nerve is pinched here, but there are no symptoms, but you get painless weakness of these two muscles, and the weakness is proportional to the joint laxity. So if a person doesn't have loose joints, they have a little bit of weakness that they easily adapt to. But if they're loose jointed, they have profound weakness, and the adaptations cause problems at the thumb and around the elbow. So if we put his hand like this, the muscles that bend these end joints are all the same size, same shape, same weight, same vectors, should have the same strength, but these two are supplied by the anterior interosseous nerve that gets pinched right here. If he makes a fist like this, pull your fingers down, pull down as hard as you can, that should be this strong. These are all normal, and this one should be the same. And these two are in the same chain. Pull your thumb down like that. You can't fake this weakness, and there's only one cause of it. But you can do this, now pull down, and it works fine. And pull your thumb down. So you get tension from contraction, but you also get tension from stretch. People adapt to the weakness by doing this, get sore, like right here. And people who adapt sideways, this gets sore, like this thumb is not supposed to do that. The hand should go with the thumb.
That's crazy.
This tendon is supposed to be here, and it's here. And when it goes sideways, it rubs on the joint and it gets sore. And this joint bends backwards, and you can move the tendon that pulls this up to here and move this tendon over and solve that problem. These tendons go sideways. And it aches when you do things, when it goes sideways like that, and the fingers will lock, and this gets mistaken for a trigger finger, but you can tie this tendon down so it doesn't go sideways. His wrist is mechanically unstable, so this is me dislocating his wrist with minimal pressure, and that tends to get sore, like right here when I do that. And there's a little bone here inside the tendon called a pisiform, and it's supposed to be attached to the hamate. And this isn't really attached. And when you move the wrist up and side to side, this bone goes sideways instead of staying where it's supposed to. And then it gets sore here. And this aches, and then people drop their shoulder, and the nerves going into the arm at the shoulder level get pulled on. And you get an ache that goes up the arm. And make a fist for me. There's a tight band here that pushes the muscle into the nerve, and you don't need this band. You can just cut it, and the nerve feels better in the recovery room.
Can't wait. Can't freaking wait. Okay, it's kind of spoony. I've got an update for you. It's 48 hours post-surgery, and today I've got the notes. Let's get into it.
This gets sore, like this thumb is not supposed to do that.
In order to repair my thumb, Dr. Ericson did a CMC joint arthroplasty and an FCR tendon transfer. And basically what he does is he harvested a tendon from my forearm and tied it to my thumb.
And move this tendon over and solve that problem. These tendons go sideways.
These tendons have rolled over my knuckles for as long as I've been alive. I boxed and did karate and was in the Marine Corps for a long time, so my knuckles took a lot of abuse. And pinning these down is just huge for me.
His wrist is mechanically unstable, so this is me dislocating his wrist with minimal pressure.
Believe it or not, as we were filming this, I really didn't feel any pain. Dr. Ericson had to do a few different things to my wrist. He did a carpectomy of the pisiform that he's moving around right now. He also did a dorsal capsulodosis of the wrist. I'm going to read directly from his notes here. Tenosynovectomy was performed for exposure. The radiocarpal joint was open transversely, and the patient was found to have a large amount of rubbery gray hypertrophic endometrious synovium with minimal hyperemia.
At the shoulder level, get pulled on, and you get an ache that goes up the arm. And make a.
Finally, Dr. Ericson concluded by releasing some fascia on my forearms. All of his notes indicate that there was pretty much like immediate engorgement of the muscle. I can tell that these fascia releases worked because I feel immediate relief already. I'm going to wrap it up for my part 4, 48 hours after surgery video. Still doing great on pain. I got control. Everything's feeling good, just resting up and getting after it. As always, if you want to work with Dr. Ericson, you can go to ericsonhand.com, give the office a call and work something out with them. See if you can consult with, maybe your own medical team just to give them advice if you can't get in to see them. I think that the more demand that we show for this procedure, the more it can be done. Kind of spoony here. I got a 72-hour post-op surgery update on the operation that I had done by Dr. Ericson. The swelling has started to go down, and my hand is pretty loose in the bandage. Now you can see where the incisions were at my knuckles. But yeah, the pain hasn't been too bad. Been keeping up with it with the medication just as prescribed. That's really all I've got for updates on my arm today, and I probably won't do another video about the arm until next week when I go back and get the bandages removed. So that'll be next Wednesday. But I'll of course be making TikToks in the meantime.
So we are now 1 week post-op, and the procedures performed, which are typical for an Ehlers-Danlos patient: proximal lead and nerve release of the radial tunnel, capsular stabilization wrist for dynamic pseudodissociative carpal instability, and Eaton-Littler ligament reconstruction using a strip of the FCR tendon, carpectomy of the pisiform, just an extensor pollicis longus tendon realignment here, and realignment of the extensor tendons. The main operation that every Ehlers-Danlos patient needs is the release of the median nerve, and it gives you the strength back to these two muscles. If we put his hand, and don't cheat, so this is a learned behavior that's not even a conscious effort. Pull his fingers down like that. I cannot bend this, and I cannot bend that either. So if we check that compared to his other side, put out hard as you can. His brain is sending the signal it's not getting to the muscle, and that's how strong he is. And these, relax your hand for a second, these run the same chain. Pull your thumb down like that. Yeah, we have to block your adaptation. Hold that there. Pull down hard. He has no strength. So and again, just to show we have to prevent your adaptations here. Pull down hard with that finger. I cannot straighten this out, and that's immediate and permanent, and it's also affects this. Relax your hand for a second. You can see how loose this is. These tendons, slide around. Already the joint's stiffer. Like you can tell, can't you?
Yeah.
That and this will be even a little stiffer in about a month from now, and the tendons don't slide around. Mm-hmm. The wrist, if I push here, it used to dislocate, and it'll get a little stiffer.
Yeah.
The thumb is attached again, and your extensor pollicis longus tendon is moved over where it's supposed to be, and this is already a little stiffer. This will get a little stiffer in the next 3 or 4 weeks. And this area that was quite sore no longer hurts.
Excellent.
These are very reliable operations in Ehlers-Danlos patients, and the recovery's pretty rough for the first couple days, but then after that, not too bad.
And would you say that this is average or to be expected, or should a patient's pain level maybe be the determining factor, or should it be the weakness that is observed in that kind of exam?
The first factor would be the functional restrictions the person's experienced, like the delta between what they like to be doing and what they are able to do without pain. So if they're couch potato, not a big deal. Trying to have a big life with a big job, this lifestyle, big problem. These things typically hurt more in women than men, but they don't show externally. So women are frequently invalidated when they see doctors and are told they have disproportionate pain and disability when they actually have a collagen disorder.
Yeah.
These operations work even in Ehlers-Danlos patients, and part of at least my hypothesis is that the nerves are soft and the muscles are tight, and then you get this sort of shift of nerve problems that then have consequences in loose jointed people.
Yeah.
It took about 5 years to figure out this nerve problem, and it took about another 5 years to figure out the consequences of that nerve problem and who is at risk, because it's not just loose joints. Some people have loose joints, it's not a problem, depending which joint it is and what their lifestyle is. But a strong, low pain tolerant person trying to have a big life and loose joints, this is what happens. I'm so excited. What happens is these two bones are tied together and they act like one piece, which would be the forearm, and these bones are like welded to each other. These would be the hand, and these three bones are connected sideways. And when the wrist moves side to side, this row moves up and down. And these two bones act like a catcher's mitt for this bone. When you grip, the scaphoid and the lunate catch the capitate. If you fall and land like this, you can stretch this ligament, and if you tear it, it's called a dissociative instability, where there's actually a tear to the ligament. If you stretch the ligament that goes from here to here, you get instability between the rows of bones, which would be a non-dissociative instability. What you had was what I call dynamic pseudo-dissociative instability, in that your ligament was stretching. So the two bones are supposed to be welded together with like a soft joint, but yours moved completely independently as if the ligament was torn. So you would have the same complaints and same exam as someone with a torn ligament, but the ligament wasn't in two pieces. And what I did, we opened up your wrist. First of all, you had a tendon problem where the tendons rubbed, probably related to pulling your wrist up to make these work, and you got a tendonitis there. So we cleaned up the tendonitis, which would just ache in this general area. We opened up your wrist sideways, and the synovium in the joint ballooned out like a loaf of bread, and it's supposed to be just lying in there. We cut it all out, and it just has nerve endings in it. We do it in such a way that the blood soaks and makes the secondary ligamentous restraints of your wrist thicken and tighten. We move over to the next joint, and there's a ligament here, the dorsal intercarpal ligament, which we split, and the lining of the joint ballooned out like a loaf of bread rising. We just trimmed it. Then that makes it so you can move it without pain. That's tissue that when you load it like this, the bones move independently, and the tissue gets pinched, and then it swells and it hurts. You had no arthritis here, but what we did was remove some of the bone right here, and remove a bone spur here, and then the tissue tends to stick to this, which gives some more stability to this joint. And then we sort of park your bones in the position that they're supposed to be in, which is a little bit of extension and ulnar deviation. And then we just let your body do its thing.
This is how you know that you're in the right doctor's office. When there's a picture of zebras on the wall.
The patient is a 33-year-old male with Ehlers-Danlos Syndrome who presents with persistent and progressive pain and weakness. His symptoms have progressed to the point where he is having trouble with activities of daily living,
30 minutes to surgery.
as well as maintaining reasonable posture, given severity and duration of symptoms,
That's the one that's already been done.
and lack of response to non-operative measures.
This is the one we're repairing today.
Surgery is felt to be reasonable at this time.
Coming out of the anesthesia.
Previously, the patient had an acute psychotic break post-op from his right-sided surgery,
Posted up.
and as a result, we have reduced the number of medications typically used with these procedures,
All bandages.
specifically avoiding beta-methazone and ketamine.
Getting ready to go home.
He is now approximately 2 months
About-
post-op from that procedure on his right side, with relief of the majority of his
Just got
preoperative
home.
symptoms. Dr. William B. Erickson.
6 or 7 hours post surgery, and it hurts like a motherfucker. I'm not gonna lie. So we'll see how it goes. But I contemplated if this was my 10 out of 10, and I think that it might be. But still here. We're gonna make it. I'm kind of spoony. I'm the patient, and in 2 days, I'm going to get the surgery done on my left hand. So I want to show you a side-by-side comparison. Starting first with my thumbs, the tendons, you can see, don't roll on my surgically repaired hand versus the soon-to-be repaired hand. My wrists were repaired really well. I have pretty much the same range of motion and very minimal pain or soreness. The final thing that I want to show you is my arms and how the non-surgically repaired one is very tight versus the surgically repaired one, which feels so much better. Okay, it's a little bit difficult to show by myself, but you can see that on my non-repaired hand, every one of those tendons rolls, and this one gets stuck. On my repaired hand now, they do not. They stay in place for the most part. Now this one I need to talk to Dr. Ericson about. You can see where it's anchored down here. I don't know if maybe I messed it up here. On my non-repaired hand, you can see how loosey-goosey that is. On my repaired hand, I don't even want to move it that much. Today is 5 days since my second hand surgery. I had the procedure performed on my right surgery a little over 2 months ago, and it was done on my left hand 5 days ago. So I just wanted to give a 5-day update on how we're doing and how the recovery has gone. First off, pain-wise, that's everybody's first question, and my answer is pain is subjective. Especially for people with my condition, we absorb medication differently, and for this operation, I went real minimal on the pain medication and actually used some anxiety medication to help me deal with the pain in a less narcotic manner. Other than that, the swelling's going fine and the healing process continues. Today is 3 months from when I had this hand surgically repaired and 1 week since I had surgery on this hand. In this video, we're going to do a side-by-side. First, I'll show you the tops of my hands because that's kind of where you can see where my knuckles have been done. On this hand, the knuckle in the middle needs to be repaired. On this hand, he did a little bit more work and it's going to take a little bit longer to heal. Second shot that I want to show you is my thumbs and wrists. There's quite a bit of surgery that goes into this. He takes a tendon from my forearm, drills a hole through my thumb, and then puts the tendon in there and ties it off. I'm not gonna lie, it kind of hurts. Then we have my wrists. He does a great job of hiding the scars in the natural seams, and these should heal pretty much just the same. And he used these incisions to remove pieces of bone in here that were just not tied down to the ligaments the way that they're supposed to be. The last thing that I want to show you guys is how my arms look after having the bands of fascia cut. You can tell that they're looking much more symmetrical. This one has a lot of pressure relieved, and I'll put up a picture from just last week that shows what I'm talking about. The non-surgically repaired one is very tight versus the surgically repaired one, which feels so much better. And I want to show you the post one more time so that you can maybe see the differences a little bit better. But it's just, there's some swelling and that's going to happen, makes it a little bit puffier, but it feels better. With that, I've got my fancy Ericson brace on, and that will wrap up my week 1 post-surgery compared to 3-month surgery post-op observations for you guys. Hope you enjoyed.
Like this thumb is not supposed to do that. The hand should go with the thumb.
That's crazy.
This tendon is supposed to be here, and it's here. And when it goes sideways, it rubs on the joint and it gets sore. And this joint bends backwards, and you can move the tendon that pulls this up to here and move this tendon over and solve that problem. These tendons go sideways. And it aches when you do things, when it goes sideways like that, and the fingers will lock, and this gets mistaken for a trigger finger, but you can tie this tendon down so it doesn't go sideways. His wrist is mechanically unstable, so this is me dislocating his wrist with minimal pressure, and that tends to get sore like right here when I do that. And there's a little bone here inside the tendon called a pisiform, and it's supposed to be attached to the hamate, and this isn't really attached. And when you move the wrist up and side to side, this bone goes sideways instead of staying where it's supposed to, and then it gets sore here. And this aches, and then people drop their shoulder, and the nerves going into the arm at the shoulder level get pulled on, and you get an ache that goes up the arm. And make a fist for me. There's a tight band here that pushes the muscle into the nerve, and you don't need this band. You can just cut it, and the nurse feels better in the recovery room.
Can't wait. Can't freaking wait. Sweet.
Today, I've got to look at my left hand at 3 weeks post-op, going from fingers to bicep. Starting with the incisions on my knuckles, each one had subluxation of the extensor tendons. Dr. Ericson repaired the extensor tendons to full range of motion. They're still pretty sore and weak, but they're getting better every day. Next is my thumb. To stabilize my CMC joint, which looked like this before, you can see how loosey-goosey that is. Dr. Ericson used a few incisions to pass a forearm tendon through my wrist and tie it to the APL tendon where it was weaved in. I am still wearing thumb braces to protect the CMC repair, but have started sleeping without one. The muscles are sore and weak and still unstable, but I expect it to rapidly stiffen up as I naturally start to use it more. Then there's my wrist. A bunch of things were done here. Again, it's sore and still needs bracing, and I'm not ready to start putting work into this area yet. Finally, I've got the forearm and bicep. Here, Dr. Ericson released multiple bands of fascia to release nerves that were trapped. He then went to my upper arm, where he dissected sections of my bicep to relieve pressure on the interosseous nerve and a bunch of other ones. I feel relief from neck and shoulder nerve pain that I've carried for 10 years now. Both incisions are healing beautifully, and I couldn't be happier. If you'd like to know more about Dr. Ericson's procedure, feel free to drop any questions that you have for me below in the comments as well. Hey guys, it's been 4 weeks since I had surgery on this hand, so I figured I'd do a follow-up video and kind of go through how everything's doing. First, if you didn't know, I have a genetic condition called Ehlers-Danlos Syndrome. It causes the collagen in my body to not be produced correctly, which leads to loose joints. I've already had my right hand repaired about 3 months ago, and now, like I said, we're on 4 weeks here. Overall, I'm really happy with how the hand is coming along and healing. Still got some tender points, but what I want to show you is that knuckle on top. You can see this knuckle right here, the tendon rolls right over. And this time, it's staying put. So I got to do a good job while I heal to not break it. That's why I'm staying in my my brace most of the time. I sleep with it off at night to kind of get my hands some exercise. But, you know, for the most part, pain, swelling, soreness, there's a little bit of that, all manageable. But yeah, everything is healing along nicely. And maybe next time we'll do a side-by-side, week 5 to week 5, since I think I do have videos of week 5 for this hand. Thanks for watching. Today, I have a 5-week post-surgery update on my left hand, which was rebuilt by a brilliant surgeon. For those who don't know, my name is Kinda Spoony, and I share resources and parts of my life living with a genetic connective tissue disorder. As you can see, there's still a little bit of edema, especially in the knuckle region. This is due to the stitches, which will be dissolving over the next 2 to 4 weeks. Also, my wrist is still pretty sore, but there's a good reason for that.
And the lining of the joint ballooned out like a loaf of bread rising. We just trimmed it. Then that makes it so you can move it without pain.
Finally, I want to show you the range of motion that I have after 29 procedures on both hands over 4 months. Pretty crazy. Hey guys, it's Kinda Spoony, and today I've got a surgical update for you. But first, I'll show you the operations I'm talking about.
And the procedures performed, which are typical for an Ehlers-Danlos patient: proximal lead and nerve release, release of the radial tunnel, capsular stabilization wrist for dynamic pseudodissociative carpal instability, and Eaton-Littler ligament reconstruction using a strip of the FCR tendon, carpectomy of the pisiform, just an extensor pollicis longus tendon realignment here, and realignment of the extensor tendons. The main operation that every Ehlers-Danlos patient needs is the release of the median nerve, and it gives you the strength back to these two muscles.
That was a lot to cover. I'm glad that he's the doctor and he can explain it better than I can. Let's get into this side by side. I'm just gonna go from fingertips up to my biceps, starting with my fingers. On the right hand, I've discussed before, this tendon will need to be redone. I actually squeezed too hard and popped it when it was healing, but the fingers and the tendons stay pretty much where they're supposed to on this hand. On my left hand, it is much tighter and still a bit tender. And you can see that there and there is where he reinforced the knuckle on this side. I got pretty good range of motion with both of them. My right wrist is much stronger than it was even 2 or 3 months ago. It feels great. It's got really great range of motion, no nerve pain. My left wrist has great range of motion, still tender. For my thumbs, you can see how the tendons stay put and move through the wrists like they're supposed to, and where the nerve releases have been done. On my right side, feels great. It's felt much better since the surgery. Like I don't have shooting pain from here down into my thumb and fingers anymore. And the same is true on this side. And then you can see this incision here is also healed really well. There was a band of fascia that was cut on this side, on this side. Finally, one of the shots that I get the biggest kick out of is just comparing my two arms side by side and just letting them relax, and it feels very nice, very loose. If you have a connective tissue disorder and you're considering surgery, I can't recommend Dr. Ericson enough out of Seattle. EricsonHand.com will give you all the information that you need, and I hope that helps somebody. Thanks. Hey everyone, Kind of Spoony here. Have you seen the video featuring the EDS expert hand surgeon, Dr. Ericson?
Ehlers-Danlos patients
It's blowing up right now on TikTok. Well, back then, my hands were in pretty bad shape. And I also had long hair. Fast forward to today, after 2 major surgeries and 1 revision, look. I can make a fist with both hands, no tendons slipping. But I'm not here just to show off my recovery. I'm here to share knowledge and close the education gap on Ehlers-Danlos Syndrome, especially in how hand surgeries are approached in this patient group. Dr. Ericson has been a magician, really. Let me break down what he did. For my right hand, they tackled everything from chronic wrist pain to painful instability of my thumb CMC joint and subluxation of multiple tendons, including the arthroplasty and realignment of my extensor finger tendons. These were game-changing. 10 days after the surgery, I was wrongfully, involuntarily hospitalized. While I was confined, I was misdiagnosed and chemically restrained. And without the help of my closest family, I won my freedom in a contested hearing where the judge ruled in my favor against the psych ward's team of doctors, and they were ordered to release me. On my left hand, similar issues were addressed. But this time, we were more cautious with medications post-surgery, given my reaction after the first round. Then came the revision surgery in 2024, specifically focusing on the EDC tendons of my right hand's middle and ring finger. It felt as if the surgery had been split down the middle, like it split my palm down the middle. So that's what we were there to do in February of 2024. And despite the challenges with the strategic use of scar tissue for stabilization, there was no need for a tendon graft. I do want to say something though, just over the last 2 years, it's become not just about the surgeries for me. It's become about advocating for me and people like me. Dr. Ericson's retirement is on the horizon. And while his shoes are big to fill, his legacy must spark a broader conversation and deeper exploration into safe and effective treatments for EDS patients. What am I getting at here? To my TikTok family and soon my YouTube subscribers under the same handle at Kind of Spoony, your support keeps me going. To those of you watching, struggling, and wondering if it gets better, it does. And while Dr. Ericson is 1 in a million, his work paves the way for all of us to find our path to recovery.